Hey guys, welcome back to allornonelaw. This is what you call quick internal medicine, and today I'm gonna talk about a very important topic, EKG. EKG, and today's topic of discussion, subtopic in EKG is what are the rules of R and S waves on EKG? Means how do they look? What are their sizes? What are the normal variations on in a normal patient EKG? Okay. We're going to talk about the two R and S waves. Okay, right guys, so remember the height of the R wave and the depth of the S wave vary from lead to lead in the normal EKG. This R and S waves come in a QRS complex. That's why QRS complex in each lead or in each strip of EKG is gonna be having a different shapes. That's why you have to know what is the normal variation of what you call R and S waves, right? If you know the normal variations very well, then it will help you to diagnose whether the patient is abnormal or a normal. Okay, so you know very well this is a P, this is a S, Q, R, and S and T, right? If this is a P, Q, R, S, and a T, right? So we're gonna talk about the two waves, that is this, right? Okay guys, excellent. Okay, now R and S wave, we have different leads. Okay, let me draw over here and explain you guys. If this is a heart, okay, if this is a heart, lead 1 will look like this. Look at this angle. We have a different what you call EKG, what you call leads. Why? Because more number of leads will give a what you call a different angle of reading the different angles of a heart and gives a good picture of heart conduction system of the heart, right? Lead 2, okay, and a lead 3, 3, 2, 1, okay. Regarding what you call just this is not a what you call perfect V1, V2, V3, V4, V5, and a V6. Okay, may not be exact guys. And then we have different what you call left shoulder AVL. Then we have the right shoulder, that's a AVR. Then we have what you call, if you draw this perpendicular, it's gonna be AVF. Okay guys, so these are the different angles of EKG strips that read the heart in a different directions. Okay, so we're going to talk about the R waves. Remember the R waves, normally I'm talking about the normal R waves and the S waves. The normal R waves increases in the height from a lead V1 to V6 as it proceeds from V1 to V6, V1 to V6, because these leads what you call they read the anterior part of the heart. Okay, so as the current moves flows into this direction, V1 to V6 the R wave will be increases in height. As you go down compared to V1, the R wave of the V1 will be more in the R wave of V2 compared to R wave of the V3. It goes on increasing slowly. Okay, but remember the R wave is smaller than S wave in lead V1 and a V2. The S waves is going to be smaller in R wave is smaller than S wave in lead V1 and V2, and R wave is bigger than S wave in leads V5 and a V6. So what happens in a V4? Maybe the same size, 3 4, right? So slight variation could be there. R wave increases in height from V1 to V6 R wave is smaller than S waves in a lead V1 and a V2. R wave is bigger than S wave in a lead, that's a V5 and a V6. Okay. The tallest R wave does not exceed, remember, the tallest R wave does not exceed 25 millimeter in height. Means how tall it should be. That should be the question, right? That might be striking your mind. Remember, the tallest R wave does not exceed 25 millimeter of what you call in height. Okay. Whereas the deepest S wave does not exceed, deepest S wave is a negative, right? Does not exceed again the 25 millimeter. Right guys? So this is the basic rules. So look at the carefully at the R wave and the S wave in each lead and check and try to know whether they are normal or not. If you think that there is an abnormality detected in what you call R and S waves, okay, first thing what you have to ask your mind is your EKG calibration is correct? It should be, what is the EKG normal calibration? That's 1 millivolt equals 10 millimeter. 1 millivolt equals 10 millimeter. Okay, remember that's the basic thing. And if the calibration is correct, you came to know the calibration is exactly right. So the patient might be having the left ventricular hypertrophy, could be right ventricular hypertrophy, posterior myocardial infarction, Wolff Parkinson White syndrome, or a dextrocardia. Okay, so regarding how the R waves changes and the S wave changes in each disease, I'm gonna discuss in another video. Okay guys, so this is really very important. Basic rules, normal variations of R and S waves in what you call in EKG leads. Okay, thank you so much for watching this video. Take care.